So we're looking at another birth complications. This is what is known as birth asphyxia. All right, birth asphyxia. So what is birth asphyxia? It's also known as what? Perinatal or neonatal asphyxia. So it's a serious medical condition that occurs when a newborn does not receive enough oxygen before birth, during birth, after birth. Alright, so the lack of oxygen tank can lead to what? Brain damage, organ failure, or even death, if you don't treat it promptly. Can you see the definition? Baby is not receiving sufficient oxygen, maybe before birth, during birth, after birth. This during birth something we spoke about umbilical cord compression, where the umbilical cord can fall into the cervix. If you want to watch that video, just comment. Right, falls into the cervix, and the umbilicus contains the arteries and veins that help to transport oxygenated blood to the baby, take away deoxygenated blood. So it involves oxygen deprivation or inadequate blood flow to the baby's brain and vital organs. Now, the World Health Organization defines it as a failure to establish breathing at birth. Right, so it's a leading cause of neonatal mortality and long-term neurological disabilities worldwide. Okay, signs and symptoms are like this. Right, difficulties breathing or no breathing at all. Low Apgar score. That's when I'm trying to access your respiration and everything. Your skin is blue and pale. Now this is because oxygen supply is so little. Weak muscles, muscle tone or reflexes. Seizures, poor responsiveness or lethargy. Right. Organ dysfunction. So causes and risk factors is this. On the maternal side, it could be that the mother had uterine rupture, placental abruption, umbilical fluid embolism, severe maternal hypotension or anemia, maybe infection during labor. All right. So on the baby's side, it could be that the baby had umbilical cord prolapse, like I was telling you guys, or the baby compressed the umbilical cord. Meconium aspiration. It could be that the first stool that the baby is supposed to pass after being given birth, the baby passed it within the amniotic fluid and inhaled it. Alright. Prolonged or obstructed labor. The labor has gone for too long. Premature birth, multiple births, you are having twins or more. Abnormal fetal position. Okay. So diagnosis is just the Apgar score, where they try to assess the well-being of the baby after they are being given birth. Umbilical cord gas analysis. You get to see that the pH is less than 7, which is what? Acidic. Neurological evaluation of signs for hypoxic ischemic encephalopathy. So imaging studies just to assess the brain injuries. So treatment is just immediate, and intensive care is critical. Neonatal resuscitation at birth, oxygen therapy or mechanical ventilation, therapeutic hypothermia, trying to cool the baby to reduce brain injury, medications to support heart and organ function, extracorporeal membrane oxygenation.